All right, I'm happy to be joined by Dr. Sully Sullivan. I think my listeners might be tired of having you on.
Nope, I think that they get excited. Honestly, it may be that they really just enjoy hearing me speak.
Oh, maybe is this the T-Bone Speaks podcast?
The Millennial Dentist / T-Bone Speaks podcast.
Well, I would argue that's T-Bone Speaks podcast / Millennial Dentist.
Well, tomato.
Yeah. But listen, this week, I want to talk about something super important. Listen, if you've been listening to me from my Dental Town days to the social media days to my speaking to the podcast, one of the things I'm always focused on is some fundamentals that help move our practice forward, that help define the next step.
Sure.
And I've had so many people ask me about doing a business seminar that teaches case acceptance and things that for 2020 we have that. And this episode, I want to walk through case acceptance, our next seminar that we're doing together, and how that's affected your practice conceptually,
right,
from the fundamentals of it, and how and who should be coming to the practice. So listen, here's what we're facing in dentistry, okay? We're facing challenging insurance companies. We're facing a challenging corporate environment. We're facing challenges from consumer or direct-to-consumer dentistry. We're facing so many challenges on these fronts. It's harder and harder to get people. Patients have more and more choices, and many of us are seeing a slow degradation or significant pressure on our practice, or that we're just not feeling nearly as professionally satisfied.
Right.
As we once did, or we're working more hours. Like, I can't tell you how many dentists I've talked to who have added Fridays but not cut out another day. So now they're working more to produce maybe a little bit more, whatever it may be. But so they're feeling these pressures. And I'm always a believer that it doesn't have to be that way. So I want to paint a picture for people where if we stop listening to people that have a lot to sell you and just get down to a few fundamental things, built around the case acceptance process, which I call the buying process for patients, we can see significant changes in a practice. So, Sully, what have you seen in your practice?
Well, let me touch back on some of that, because really I think you hit the nail on the head with some of that. And what's interesting when you talk about that is every single one of us as a dentist is hit by a lot of those things. It's not that, and
all of them, some of them, it doesn't matter.
Exactly. And we're all in the same kind of boat of how do we really move forward in this day and age in dentistry? And there is a lot of, noise out there that kind of distracts what potentially we should be doing. And a lot of it looks really exciting, it looks really fun, but it really gets away from the fundamentals of things, which is really what drives the core of our practice and really moves the needle. So for us, I've been fortunate, obviously, enough to spend a ton of time with you and really hear a lot of these core fundamentals that you've talked about in numerous episodes when we talk about case acceptance, being patient-centric, those type of things. And what we've noticed is really those core fundamentals are having the biggest trickle-down effect to everything in our practice.
Yeah, I think what you're referring to is, I think what we were talking with our friend this morning was that we go to seminars, we go to something, and we see a shiny new object.
Exactly.
And we get off course, and we never come back to the basics, because the basics is that's what allows me to do hybrids. It's what allows me to do cosmetic cases. It's what allows me to do implants. Is learning the clinical part of it isn't.
It's the easy part on some level.
It's not the complicated part. Learning it. It's not the hard part to find. It's the process to get the patients to say, yes, that is that. So listen, let's talk about, there's 3 steps I look at it. I don't think we have a case acceptance problem in dentistry. I believe we have a diagnosis and communication problem.
Totally, yeah.
We're simply not doing what it takes to diagnose better. And then once we do diagnose or don't diagnose, we don't have such a great buying process for our patients. And the buying process is pretty simple. It's, how do I handle patients that don't fit traditional dentistry? And how do I make it easy for my patients to afford the dentistry I want? To me, that's the buying process in a nutshell.
Or as you put it before too, dealing with the fact that people basically have 3 things that keep them from moving forward.
It's time, fear, and money. And the question is how, for you listening, how are you addressing those 3 principles?
Amen.
Time, fear, and money.
Yep.
If you keep answering those questions over and over and over again, you will win however you want to win.
Exactly.
It doesn't matter. You want to be a cosmetic practice, time, fear, and money. You want to be an implant practice, time, fear, and money. You want to be a family practice, time, fear, and money. You want to be a dental fixed hybrid practice, time, fear, and money.
And this is where really this whole idea of kind of what's next comes into play, because when you either, whether you're graduating from dental school, whether you're buying your first practice, whether you're transitioning to hiring an associate, whether you're trying to grow procedures, whether you're, wherever you are in your career, it's always coming back to how can you deal with those three things, and what then does that allow you to do with where you want to go with your practice?
Yeah, you left one block of generation out, and that's my generation. Where you're less satisfied or you're burned out.
Sure.
And you're trying to transition that associate in, or you're trying to transition to a fee for service model, or you're trying to transition into 3 days a week, and ultimately it all. Maybe I'm simplifying this too much, or maybe I've just been lucky in my career, but it always boils down to time, fear, and money. If you're trying to grow a practice, you have to address time, fear, and money to do more dentistry.
Right.
If you're trying to slow down and get away from insurance, not that I personally agree with that, but you're trying to get away from insurance, you got to address the time, fear, and money, more so the money part with the patients. If you're trying to transition an associate into your practice, and I'm a firm believer that every solo dentist should make it a goal in the next 2 to 3 years to hire an associate dentist.
Yeah.
But part of that is most dentists don't feel they have the business, but part of the reason they don't have the business is because they're not doing more advanced procedures. And the reason they're not doing more advanced procedures, the common excuse is, well, I don't have that patient in my practice, or the patients that want that procedure. And my answer is, what patient doesn't want to replace their missing teeth? They simply can't afford it, or they're afraid of it, or they can't fit it into their life. Back to time, fear, and money.
Everything.
So how have you addressed time, fear, and money in your practice?
So, well, obviously the biggest thing that it all goes back to kind of, you've talked about vision and goals and that sort of thing. And when I came into the practice 4 years ago, we had to address those things because there was this survival thing for me. I was going into practice with my dad. We wanted to go to the practice. He didn't want to cut back.
So did you, let me, I don't.
Oh, of course.
Because I want to give some context here. Okay. So when people, because I've heard this from other people when I talk about you, is he walked into his dad's practice.
Totally, yeah, I get it.
So when you walked into your dad's practice, was it ready for a second dentist?
Not at all.
Not at all.
So, and that was the scary part, right? And look, it was a huge advantage, the fact that I look like him, talk like him, whatever. I'm never going to discount that. But the reality is dad was running, about a $1.4 million practice, doing all the normal dentistry that people would do. Right. And his biggest fear, he would tell you, is he was sitting there going, where the heck is there going to come dentistry for the doctor to do?
Yeah.
It wasn't
he wasn't in a position or ready to say, okay, I'll let you have 400 grand of that and I'll do $1 million of it.
Like the last, and it's not that, that's the other thing that's kind of funny is it's not like he's cut back at all. I mean, he's doing more now than ever. So the practice either had to grow, or we were going to have really not fun Thanksgiving dinners, or I was going to leave. And so much of ours came from that desire to grow. And then, so we started looking at, okay, what can we do? And it truly got back to patient experience and case acceptance when we started doing more dentistry on the patients that were already in our practice.
So now you're talking about clinical diversity to a certain degree, right? So clinical diversity, which we haven't touched on yet, okay? And that's the fundamental, ultimately clinically, of everything that I talk about, okay, is that we got to expand our services. In other words, you got to take that 2,000 people patient base and you got to get more out of them. And the easiest way to do that is to add services that you're not doing, that your patients want and need, okay? So how'd you guys do that?
Well, the first thing we did was we looked at, okay, what do patients want out of the gate, right? And so when you deal with those issues, that's great because patients buy what they want, not what they need, right? So the first thing we did was we added ortho.
Okay.
Patients want straight teeth. They were asking for that.
And when you say ortho, are you referring to comprehensive adult, or child, adolescent, change bite?
So Invisalign, 6 month smiles, clear correct, those
cosmetic
type things.
ortho.
Right, exactly.
Cosmetic relapse or people that didn't have
things.
it because they couldn't afford it when they were kids, and you're just focusing on the front 8 or 10 teeth.
And it was baffling how quickly patients would say yes to that when they realized they didn't have to go somewhere else. They could do it in office. It was affordable, all those types of things.
Let's back up for a second. Let me slow you down, okay? So what I hear is you identified a need in your practice and patients didn't say yes right away.
Right.
Okay. What happened is you had a fundamental buying process in place to make it easy for patients to say yes. Because the same process that allows patients to say yes for fillings and crowns is ultimately the same process that allows people to say yes to ortho,
right,
and other procedures. So you added ortho. What else?
And then after ortho, it really became, okay, how can we again diagnose more, right? It's not a case acceptance problem, it's a diagnosis problem. And for us, the next big step was cone beam.
Okay.
And with cone beam came implants. We weren't placing implants. Way more endo from a standpoint of we just saw more endo.
Exactly. You caught it early.
You feel more confident, comfortable doing it because you know what you're getting into.
Yeah, necrotic teeth that are asymptomatic.
And then ultimately that led to sleep. You know, that started my entire sleep journey, was getting into looking at airways on cone beam and the pathway that we had to do that. And so all of a sudden we double our practice and more
without adding patients.
Without adding, well, basically, yeah. I mean, we went from 1.4 to 3.2 last year and added 400 patients.
Right. Overall active patient
which is
base,
like, you're talking
it's nothing.
15%, 12%.
Yeah.
And then, but what you look at is, okay, we're basically getting double amount of dentistry out of the patients. And it's not that, the beauty of this is, it's not that we are just diagnosing all this more dentistry. It's that we're now delivering dentistry that patients wanted, that we were either sending out or we were just never offering them.
Right. So let me digest this a little bit so that that those of you listening, if you're a solo owner and you're my age group, okay, that 40 to 50 ballpark, okay? I'm on the 43. I always say, because I want the bottom half of that. So,
well, even a little, I mean, my dad was is an older version of that.
Right.
You know, that's what he was exactly. He was 50, 51, right?
Yeah, so the same generation, right? So what happened is we grew up in the general dentistry ballpark, okay, where it was fillings, it was a crown and bridge.
On the hamster wheel,
okay,
crown and
bridge,
yeah, all that
crown
stuff,
and bridge, right? And so what's really happened is they've been able to grow the practice by adding procedures. And so if you're a solo dentist and you want to grow your practice, you want to bring in an associate, I don't think the answer is to double your general practice. I think it is to add procedures and to squeeze those procedures out of the patients. So there's 2 steps you got to do that, okay? Number 1, you got to have a fundamental buying process, some basic things so patients can say yes. And number 2, you got to have the clinical skills and the tools to be able to execute those clinical skills. And so technology fills 2 of those roles. It helps in the diagnosis and the communication, certainly.
Sure.
And then it helps in the execution on the clinical side of things. So,
and they kind of go in tandem, because as we were getting better clinically or learning these things or investing in this technology, meanwhile, we were also, and this is something I think is missed a lot of times, if you're not at the same time working on improving your case acceptance skills, your communication skills, your payment options, all these things, then that clinical diversity is worthless. And we see so many practices that doctor goes to stuff, they learn how to do something else, and it never has this significant impact because they're not working on the business side of their practice equally as they're working on the clinical side of their practice. They have to go in tandem.
And that's what people miss. And that's really where the next seminar fits in, right? It is, I call it the business of clinical excellence. And it's the fundamental business that you need to do clinical excellence, And
it gets back to just the fundamentals of things when you really start to see wherever you are in your practice, whatever your type of dentistry you're doing, it works.
Yeah.
And that's the beauty.
Well,
it's not necessarily specific to I run a fee for service. Yeah. Well, perfect. It helps you. Yeah. I run a PPO practice in rural Arkansas. Perfect. It helps you. I mean, that's the fundamentals have so much impact.
Well, I'll argue that the buying process that I teach is more impactful on a regular general practice than it is on a practice doing more advanced procedures. Okay, because at the end of the day, it's easier to get patients to buy crowns than it is to buy elective treatment.
Right.
And as long as you make it, and it's really about getting them to do more of those. It's about doing quadrant dentistry.
Let's tease this patient experience buying process. Let's talk about that a little bit. What is that going to look like at the next seminar?
So, what we teach is that ultimately the patient process, the patient experience is treating people good. I mean, look, I think that's easy. We don't need Ritz-Carlton. We don't need Disney. You just need to treat people well, okay?
Right.
Just treat people well, okay? But I think the crutch of the patient experience is how do we diagnose and communicate more, okay? And to me, that falls down to photography and imaging, okay, to help us diagnose and to communicate that. So for those of you that aren't masters at words, that aren't great at speaking to people, don't speak. Put the picture up and say, point like a caveman to the picture and say, this is what you need to do. Okay.
Yeah. Yep.
So to me, that's the crutch of it. Okay. So for us in our practice, that has been digital photography, 3D imaging, and digital impressions at the hygiene visit. Okay.
Right.
So those three things. Okay. So that's how we're leveraging diagnosis and creating communication. And the communication is 2 steps for us. Step 1 is using those 3 technologies. Okay. And then step 2 is words.
Yeah.
You know, how we communicate, all of that stuff. Okay.
Well, and one of the big things that I say it all the time is patients buy what they want, not what they need. Right. And so it's amazing how when you utilize those photos and that technology, and you just ask the patients what they want,
right?
How much dentistry they will diagnose and tell you, and versus what we're taught in dental school is you could go tooth by tooth and tell them all the things they need to fix, and no one moves from that position. So those things really do make a big difference.
Let me give you, I don't like to use the word script, okay, but let me give you an example of that, of how I would communicate with the patient. Let's pretend I looked in Sully's mouth and I saw a lot of stuff going on, okay? And
probably some buildup. I just get my teeth cleaned this week, actually.
I don't care about cleaning's part. That's good. But let's say you need a lot of restorative dentistry, okay, or just a lot of dentistry in general.
Probably if I'm on rehab with my grinding.
And then, so the traditional model would be is that you diagnose everything and then give your patient a printed plan and go from there. Okay.
Right. With all the codes and
all that BS, right?
Yeah.
My model would be is that, hey, listen, Sully, there's a lot going in your mouth. Okay. I'm going to give you a choice. Okay. Choice number 1 is I can overwhelm you with all this stuff going on. Or choice number 2, we can decide to be focused and just start in a given area. Do you prefer to be proactive or reactive? And how would you like me to give you a treatment plan? And we'd have the photos up. And most of my patients say, yeah, listen, I know there's a lot going on. Part of the reason I left the other office is because it was just overwhelming to me. Let's start with an area. Let's just pick a tooth.
Yeah.
Okay, so we don't diagnose everything else. We make notes of it and chart it, but then we make a treatment plan for that area. And then we get our patient moving on that area. We build trust, we gain confidence, and then we move forward. And what we have found by doing that is in 3 or 4 well-planned visits, we're able to knock all the patient's dentistry out.
Sure.
And they're better visits for me, they're better visits for the patient, and go from there.
Or I'll even turn it around on you on that. The flip side of that is how often are we afraid to truly diagnose and show them everything that's there because we don't want to overwhelm them?
Right.
When if we had just asked, and it's amazing how many people want to know the big picture.
Someone will say, hey, I want to start with one thing, but I want to know what else is going on.
Exactly. And then next thing you know, when we start talking about how we can treat, time, the money and fear, then all of a sudden they're saying yes to a lot more dentistry at one time. And that to me is where this really hits home.
So part of what we'll teach in the next seminar is what I call the permission and choice method. Okay, we get permission from the patient and we give them a choice, and then from there we essentially go down the path that we want. The choice we get from them is the path we want them to go on. Okay, so certainly there's influence involved in that. Okay, and then once we go down that path, we've kind of got our treatment plan put together for our patient. And then the next step, okay, and a lot of offices are reasonable at that step. I'm not saying we're great, okay? We're just less worse than others, okay?
Right.
But this is where it breaks down, the buying process. Now that we've got that treatment plan, we've got it down to what the patient wants to do, it's amazing how many dentists don't have a firm buying process for their patients.
They haven't made dentistry affordable.
Well, I would even argue beyond, I would say that's a component of the buying process. To me, the buying process is going to be how do we present that treatment to the patient? How do we make it easy for them to understand what we're presenting? Okay. How do we make it so that it's rememberable, so that way when they call back a month later or 2 months later, they know what they want to do?
Right.
And then how do we make it so that it's affordable for them and transparent about how we're going to make it affordable, so that, again, when they call back a month or 2 from now, you're not revisiting the affordability conversation.
Right.
And to me, that all falls on what I've learned and called the firm financial arrangements. And that's how do we have a financial menu in place that our hygienists, our assistants, our front office people utilize to clearly and transparently communicate the treatment plan in consumer-friendly words. And how do we use that to also transparently provide our patients with how to pay for the dentistry.
And I'll be honest, I lagged on this one for way too long. And when I look back on 2019, as we kind of are, rounding towards the end of the year, implementing those firm financial arrangements, having those conversations, giving the patients options, that probably is the number one biggest thing that's impacted our growth this year, I think.
Well, and this is what drives me nuts, Sully, is fundamentals work. If you go to golf, we talked about how you're trying to get better at golf, so they can try to beat me, right? so it's you can go to somebody and they're going to try to fix your swing, and that's the wrong. In my opinion, okay, because one, we're not professional golfers that are playing every day, all of that stuff. But the person that just tweaks your alignment, that tweaks your tempo, that tweaks some of the ball position is going to make massive differences. It's not going to make you a pro.
Totally.
Okay, but it's going to take you from a 20 to a 10. Okay, over a little bit of time. And that's what firm financial arrangements does.
Well, I think that's on some level, the whole point of the next seminars is to try to get laser focus on certain areas that have significant impact versus trying to be spread across 30 different things and nothing's really moving.
Yeah.
I mean, that to me is a big one.
Well, I want to bring up something now that, so you've been listening to me talk about this for years now on the podcast. I've essentially talked about the same damn things over and over again. Is firm financial arrangements, in-office payment plans, financial menus, diagnosis, expanding procedures. It's the same thing. For 3 years now, I've been talking about the same thing. But what holds people back from being successful is that the dentist is the only one that hears the message. Right. And then they go back and try to implement themselves. And I'll use my own team as an example. My team will hear you talk about it and say, oh, we should do that.
Isn't that great? I love it.
And I'll say, hey.
Like it's Sully's idea.
Right. But I've told them this so many times. So what happens is the truth is that we don't coach our team well because they don't want to hear us as well because we're the boss and not the expert, right? And so I face that in my own practice. And so a fault with my overall philosophy is that it is so team dependent. Okay. And so if you don't get your team on board, if your team doesn't hear this, if your team doesn't understand what's in it for them and how they benefit and all of those things, it's going to fall flat on the face. And I think that's what we've done with the next seminar. That's quite frankly stupid is that we've made it $250 to $300 per person. A 5-pack is, I don't know, $1,500, $1,600 because in fact, the dentist cost is $100 less than bringing 5 people. Yeah. So, because we've done it so that way, in a perfect world, I want the dentist, a lead hygienist, a lead assistant, and a lead front office person. That is my minimum that I want people to bring.
Right.
Okay. If you can't bring those people with you, I think you're going to learn something certainly, but you're not going to see the
it won't
big
have
benefits.
The kind of impact that
it won't have the benefits that you need. So let me repeat that: the dentist, the lead hygienist, the lead assistant, and a lead front office person are the 4 people that need to show up at the next seminar. And the next seminar is February 28th in Nashville, Tennessee, and May 8th, 2020 in Chicago, Illinois. Okay. Illinois.
No, and it's gonna be fun, and I think that I'm with you. I think the more team members you have, the better. I think they're the ones that ultimately drive this, and they've got to be there because the stuff that we're going to be talking about is different than the way that traditional schooling and whatnot has taught them, and so there is a level of trying to rework, all of our brains to think a little differently, and the beauty is if you can start to do that, if you can start to see the big picture, if you can start to see what you can do and by, having clinical diversity and implementing some of this stuff, you're going to have more fun and enjoy what you do and, and make more money. And that's the best part about it.
Well, the other benefit of the clinical diversity and all of this is you show your team members a path forward. Yeah. You show them what's next in their career.
Right.
I always use Liz as the example. Liz is roughly my age. She's a little bit younger than me. And, she realized that 10 years from now, she probably can't be clinical assisting the way she is when she was 32, 33 years old.
Sure.
She couldn't run as hard, or she couldn't work as hard, or we couldn't work through lunch as much, or all those things. And so by having team members understand our concept of champions, our concept of clinical diversity, and how all of the fundamentals of the business fit into that, they can see that how they can stay in your practice, help your practice, help themselves. They can earn more, they can work less, they can extend their careers, they can extend their satisfaction. And that's part of the process, right? And for example, you have a hygienist that is not doing hygiene essentially, right?
Yeah, she's just asleep, yeah.
Right, and I have a hygienist that's only doing hygiene 2 days a week and doing treatment planning and coordination 3 days a week.
Well, and where it really clicked for me was realizing that when I was trying to do everything, what we were focused on, we'd be really good at. But as soon as we tried to turn to do something else, that would drop off.
Well, what you're saying is as soon as you moved on to the next thing, things dropped off because your team wasn't engaged in maintaining.
Right.
And then, listen, here's the truth. When you move on to the next thing, there's going to be a drop. But what you got to avoid is the cliff.
Right. And that's what was happening. It was just things would stop, right? And then, you start to empower those team members and get them to champion that stuff. And part of it is the team, they want to be at a place where they enjoy what they do and have fun and are in a fun office that's moving forward. And so by getting them to these type of events, they're going to help push the doctor. They're going to help push you in a way that keeps you going. And that's a big part of it too, I think. Yeah.
So let's talk real quick about who is next not for. Because I think as much as we can say who it's for,
sure.
I like always telling people who shouldn't come.
Yeah.
Who should. Well, number one, if you're easily offended, you probably shouldn't show up. Okay. Because I'm bad enough, and then we add you with me a little bit, and certainly, listen, I'm T-Bone 2.5 now, so I'm certainly a little bit less in your face than I used to be. But if you're easily offended, that's one thing. If you're looking for a magic bullet, then I'm not going to give you a magic bullet. I'm going to give you a lot of things that need to be done. So those are the things that stick out in my head.
Another one, is if you find yourself being the one that you have to micromanage everything, you can't let your team,
or you can't envision yourself delegating.
Then that's going to be a struggle because conceptually, we want to work smarter, not harder. Yeah. I want to empower my team members. I want to take more time off to my family. I want to take more time to do stuff I want to do. And I can't do those things if I don't build my team up to do it, if I have to do everything. Yeah. And so I think conceptually that's a big part is be willing to think differently. Yeah. Be willing to say, you know what, I've done this for 15, 20 years, et cetera. But hey, maybe it's time for me to think a little different.
Yeah. I'm thinking all the objections that people have. And so here's one I hear. Well, I don't have the right team members right now. I don't have good leaders in my team. And so I'm not ready for this. And my argument would be, I'm going to use I don't know if you ever watched Mad Men on AMC, but there's a little lady named Peggy Olson in that who was a secretary. And if somebody never gave her a chance, she would have never become the ad person that she was at least in the show, So there are diamonds in your practice that you don't realize because they just walked in and started doing it the way it always was.
Right.
And you assume that there's not more in them.
They have been shown a bigger picture.
Right. And so I would argue that you'll be shocked. I'm just shocked at what's in your practice already. And sometimes it might be a reality check of what's in your practice, but you'll be shocked. But okay, so now on the flip side, who is next for?
If you're looking to figure out what is it that I'm missing to increase case acceptance, to get more people to say yes to things, to figure out how do I navigate where to go? Is it do I in my CE journey, do I place implants? Do I do sedation? Do I do sleep? Where I think that's a person that's for, someone who's trying to find out what is that next step that I need to take. That's it. I'd also say that if you're someone who is content, you're kind of at the point in your career and your practice where you make good money, but you're bored. I think this is really that's the person that's
your dad
really
basically,
for.
right?
Yeah, because people, I'll be the first one to say, obviously, Dad and I were very helpful for each other, but the biggest thing that happened was a wrench was thrown in his wheel.
Right.
He had a disruption of change that made him start to look at things differently and do things. And to me, that's what I think we want to be. Yeah. I think we want to see you there, and we want to try to disrupt things a little bit because we've both seen the benefits and what it can do to everything in our practice.
And how we want to deliver impact for people.
Yeah.
So what do you think about young people? I'm new in my practice. I can't afford things. But that's your generation. That's what I constantly hear. I can't afford.
And it's frustrating to me because here's the thing. You know, I always joke with like technology because on some level, our generation's we will have technology. It's only a matter of time.
You'll have technology on the things that don't make you money.
Well, like that's for sure.
In your pockets, basically.
Yeah, and cool cars and that sort of thing. But to me, it should be almost mandatory for the new graduates, the new owners, et cetera.
What if you're an associate?
I think it's even for the associate, I think it's time. Because to me, it's going to start to get you to drive you to either do one of two things. Either push to maybe get into ownership, realize you don't want to do ownership, or that you're not in the right spot. Yeah. You know, and that you're not being allowed to flourish in the way you need to flourish.
Or to give you a vision of what's possible. So many people I've met, young people, they have a vision of dentistry as just one way. It's a hamster wheel. It's drill, fill, bill, drill, fill, bill. Oh, I'm going to be an associate forever. It's too hard to do this. And sometimes we just need to hang out with people that are just not that.
When that's like, so, I mean, not to toot your horn.
I love that. I appreciate that.
But so, you know, I go back to March 2016. We are at a 3D summit in Nashville, and I hear you speak. You know, and you got up there and you started talking about this dental practice that you could have where it wasn't drill and fill. You could define your schedule. You could do the dentistry you wanted to do. You were having fun. You were making money. And I was like, you know what? That's what I want. You know, my vision for what could be of what I saw either in my dad or other dentists, like that was what dentistry was. Right. And you showed me
that's all they ever saw.
This vision of like, okay, why does it have to be that way? Yeah. And to me, that's so critical. And so that is why I think for newer or younger dentists, this is so important because this event is going to give them an idea of what can happen. Yeah.
I mean, look, at the end of the day, what's the worst thing that happened? You spend $1,000 on something and
we should raise the fee.
Right. But you spend $1,500 on something and you know, you learn what you don't want to be. There's a lot of value in learning what you don't want to be, you know? And look, I say this to the young generation and quite frankly, my generation as well, is there's a problem with online learning. And the problem with online learning is that there's no interaction with human beings. You don't get around like-minded people. And that was the biggest thing in the mastermind from 2019 was that people talked about how they just wanted to be around people that were as driven or that were in the same place in life and as motivated and enthusiastic about dentistry. You know, dentistry, in my opinion, is the greatest profession. It's afforded me an unbelievable life. It's afforded me an unbelievable schedule. It's afforded me an unbelievable income. And more importantly, not about the income, it's afforded me the ability to have an unlimited potential. And that to me is like literally if I can turn the faucet up or down based on what I want to do.
Right.
And that to me is the beauty of it. Okay. So again, clinical diversity. We'll go through the SSOI. Okay. The SSOI is sleep, sedation, ortho implants. How I think an underutilized skill that every general dentist needs to have is sedation.
I cannot agree. Yeah. I can't agree more.
Yeah, I mean, it's underutilized, and so we got to get there, right? So again, the next event, February 28th, Nashville, Tennessee, 2020, May 8th, 2020, Chicago, Illinois. Depending on how these two events go, and Nashville already has 55, 60 people in it, and Chicago has like 40 people in it.
We're doing really well.
So we're doing good. Excited. So depending on how these events go, then we're going to do probably 3 or 4 more the rest of the year in different cities.
Basically, really fun cities that we want to go visit in.
Basically, cities that our wives said they'll go with us too. You know, and
well, look, the events in Nashville's on a Friday. Come in, spend the weekend, have a good time. I mean, Nashville's a great, fun city. Obviously, I'm biased because I live there. Great food, you know, and then Chicago is going to be, I mean, Chicago in May is going to be great. Yeah. And Chicago, we're actually doing it at the White Sox Stadium which will be really cool.
So you get a tour of the dugout and all, I don't know how all that works.
Yeah, they're going to be really fun. So if you're looking for something that you just think, you know what, I need something to come in there and fire me up and get me reignited, bring your team, come hang out with us. I promise you it will be.
Get your team excited about dentistry again. That to me is the minimal that you'll get out of the next seminar. Yes. The minimum. is that your team will leave excited about dentistry. They'll interact with other team members, and amazing things happen when you put people in a room and force them to talk to each other.
I love it. I can't wait.
Again, next seminar, February 28th, 2020, Nashville, May 8th, 2020, Chicago. More information at tbonespeaks.com or 3d-dentists.com. This is T-Bone with the T-Bone Speaks podcast, joined by my great friend and partner,
The Millennial Dentist, Sully Sullivan.
Sully Sullivan, the Millennial Dentist. Everybody have a great day, and we'll see you on a future episode.